Hi, today we're at ESHG 2015 and the question here today is, what is the Stratified Medicine Innovation Centre and how is it creating a unique and sustainable capability to service the health needs of the Scottish population? Mark, it's fantastic to see you again. Can you tell us what's meant by stratified medicine and what the objectives are of the Stratified Medicine Scotland Innovation Centre?
Good to see you again, Mariangela. Yes, stratified medicine, or precision medicine as it's also known, is the means by which we are going to be linking the response of a patient to a particular therapy to their genotype or phenotype. It's a really exciting area, fast moving. We've been setting up a unique collaboration recently in Stratified Medicine Scotland Innovation Centre, using the best of the field from industry, from the NHS and from academia to help reduce this to practice.
So you mentioned that one of the key aims of Stratified Medicine Scotland is to link phenotype and genotype information to better predict patient response to therapy. Which disease areas are you currently studying and how might this better predict future treatment?
So you're right, Mariangela, we're looking at 5 therapeutic areas to understand the phenotype-genotype relationship. We have 2 programs in oncology, one in multiple sclerosis, one in rheumatoid arthritis, and a combined IBD-COPD program. I'll pull out 2 examples to illustrate the areas we're working on. One of which is the rheumatoid arthritis program. Currently, patients in the UK who are diagnosed with rheumatoid arthritis go on a first-line therapy called methotrexate. This is a well-established drug with a well-understood safety and efficacy profile, works very well in the patients it works on. The downside is it only works in about 1/3 of those patients. And what we're trying to do with this particular project is understand the genetic and phenotype relationships that would predict response to therapy. The second example, the multiple sclerosis project, is a really exciting area in the field of disease progression, understanding disease progression. Currently, there's little evidence base today to allow a doctor to predict which patient recently diagnosed with multiple sclerosis is going to progress rapidly through that area, through that field, and which are not, and going to be relatively stable. The drugs used to treat MS are expensive and consequently often rationed. So what's really important is to provide the doctor with the ability to understand which of their patients in front of them are going to progress rapidly and direct therapy appropriately. And that's what this project's going to be doing.
So Mark, what makes the Stratified Medicine Innovation Centre unique in what it can offer the scientific community?
2 things are unique, Mariangela. The first is the nature of our collaboration. We pulled together in SMS-IC a unique grouping of industry, of NHS and of academia to help develop this capability and prove it out. This collaboration brings the best from all 3 disciplines to answer what is a very complex problem. We've recently won an award from Scottish Enterprise, which was presented to Thermo Scientific, ourselves, Iridia, NHS and Glasgow University for this collaboration. The second thing is the attribute of being able to work in Scotland. Scotland has a fantastic patient population for phenotype, genotype, stratified medicine studies, with a long established history of complex and chronic disease, but probably more importantly, a very well comprehended set of electronic clinical records, which will aid the understanding of this phenotype-genotype relationship. Those records are long and deep, they're 5 million patients wide and they're up to 20 years deep. What's more important, they're all linked together by a unique patient identifier called the Chi number that really facilitates the understanding of a patient's individual response to their disease.
Okay, great. So what's next on the horizon then for Stratified Medicine Scotland?
So one big thing coming up in August this year is our move from our current site on the Thermo Fisher site in Inchinnan to our purpose-built home out at the new South Glasgow University Hospital. This is a fantastic new hospital setting, just opening now, 1,200 beds, I think the biggest single-site hospital in Western Europe. And we've got a purpose-built facility that again houses a grouping of industry, academia and NHS. So that's going to be really exciting to be there, and we're really looking forward to it.
You must be. Perfect. Thanks, Mark.